Think about this. By the time you go to bed tonight, 13 of your fellow Pennsylvanians will have died from an overdose of prescription opioids or heroin. 13 people. That's the starting lineup of your kid's soccer team plus 2 substitutions. That's an entire Sunday school class. If current trends continue, and there's every reason to believe they will, more than 4,600 of your friends, neighbors, and loved ones will die by year's end. That's a good-sized Pennsylvania borough. Despite the good faith efforts of policymakers, lawmakers, public health experts, law enforcement and educators, even our clergy, the death toll has continued to rise. As an editorial board, we've spoken out on this issue for years, urging lawmakers and policymakers to act aggressively to confront this public health threat. We've told the stories of those on the front lines trying to break the cycle of abuse and to save lives. But it hasn't been enough. So today, with a rare front page editorial, we're stepping up and raising our voices in the face of this unprecedented public health threat. We'll be calling for the passage of legislation, for increased training and education for all those touched by this epidemic, and for tax credits for employers who offer life-saving services to their employees. Most importantly, we want President Donald Trump to recognize this threat for what it is, and to declare a national emergency in response. We'll do our part too, by telling the stories of those fighting this threat, by convening forums and public events to search for solutions, and by reaching out to our readers to ask them to lend their expertise and passion to this cause. If there's any reason to doubt the urgency of what we're up against, consider the numbers alone. Nationwide, 1 in 3 Americans, or 98 million people, used prescription opioids in 2015. The economic cost is also staggering. In 2016, prescription opioid overdoses, abuse, and dependence cost the nation more than $78 billion. Those hardest hit by this epidemic are not strangers. They're your friends, they're your neighbors, and they're your children. They're Casey Schwartzmeyer, a 20-year-old from Allegheny County, whom her mother described in a heartbreakingly candid obituary as funny and full of life, and she was a drug addict. They're Terry Wayne Mathias, a 39-year-old father of 2 from Greensburg in Westmoreland County. His was one of 86 deaths in Westmoreland County to be caused by an overdose of fentanyl, a deadly synthetic opioid. Like the great fights that have come before, this is one that calls on Americans to summon the best things in themselves to get the job done. Their strength, their tenacity, their will, their grit, and most importantly, their compassion. In this fight, we cannot shirk from our duty. Please join us.